Hello, hello, hi. So I'm Dr. Shail Gupta, and I am here again on YouTube Live. And today's topic is synthetic hair implant. So, you know me, I'm a hair transplant surgeon who has been practicing for almost 2 decades now. And yeah, hair transplant is a very important um, decision of your life, and hair transplant is obviously um, yeah. Hi Naresh. Hello Netherlands. I am doing fine, Naresh. Hope you are fine. Yeah. So today's topic is synthetic hair implant, and as we know, hair transplantation, sometimes there are some limitations, like we don't have enough donor. Suppose if somebody has got a transplant done earlier and they are like not having enough donor reserves left, then in that situation we have to do something, and one of the options there is one of the options there is synthetic hair implant, which is kind of useful in patients where there is no donor. And the second indication for synthetic hair implant is in patients where we don't have time, like if somebody has a function in family, or they can't wait for natural hair transplant results to grow, because we know natural hair transplant takes time to grow. So, hi Brijesh. Hello. Yeah, good. So, Pankaj bhai, or yeah, you know, we'll put some updates on that. But see, since the information is very limited, so um, we all know the same things, about it. Synthetic hair means artificial. See, okay, let me clarify this. There are three things. One is natural hair transplant, where we obviously take out hair from back of your head, and then we plant these hair in the scalp. These hair grow and they keep on growing, and it is like as good as your own hair. Then the second is wig or weaving, which is like a patch which can be fixed on the scalp with the help of a clip, or maybe some glue or adhesive. And the third one is synthetic hair implant, um, which is a very good option in cases this is implanted in the scalp under local anesthesia. And these hair, they exactly look like natural hair. They don't grow. There is around 15 to 20% hair loss per year. So synthetic hair is very natural looking thing. We can implant it. Sometimes, many times, people get the synthetic hair implant done in the frontal area, and backside they wear a patch. And that is true for even natural hair transplant patient. If having a high grade of baldness, we can use synthetic hair, and we can use even natural hair for the frontal line, and backside patient can wear a patch. Or sometimes we combine natural hair transplant with synthetic hair implant, where important areas we cover with natural, and the leftover areas we do with synthetic. And especially it is very important in patients who have already failed surgeries, who have less donor left. And in those cases we can combine this. Sometimes we add scalp micropigmentation also, and that really helps to create an illusion of fullness. And especially role of synthetic is important in patients who have already consumed their donor, who have very less donor left. Yes. So is Redensil better than minoxidil? See, minoxidil, we all know, is a very well-known compound, and it's in the market for more than 30 years now. And a lot of data and studies back up minoxidil, and we all know that it works, and it works in most of the cases. While Redensil is a relatively newer medicine with not that much of supportive data, so we cannot exactly compare. But yes, the companies claim that The results are the hair which stay in anagen phase are long, like is better than minoxidil. But long term studies are still awaited, and big comparative trials are awaited. Naresh, if you do synthetic hair transplant, do you see only single implants, or do you use two hair or three hair implants? Yeah, good question, Naresh. See, we have basically two types of synthetic hair with us. One is a single one with a single knot, and the one knot goes inside the scalp, and uh, single hair grow out of it. And the second is multi-hair density (MHD) hair, where we have three hair attached to one knot. So there is one knot which goes inside the skin, and then there is an external knot which holds up the three hair together. So the advantage is we can achieve more density with three in one hair, and it looks more dense. And another advantage is that only one knot is going inside the scalp. So one knot, less knots going inside, that means less inflammation and more time this hair can stay because of less irritation. But the disadvantage of three in one is the external knot which remains outside the scalp, it most of the times it gets pulled out easily because there is it is outside the scalp. So the fall rate in some patients of this multi hair is very high, and we have to replace it eventually very frequently. So we generally recommend a test patch where we do when we do test patch, we do single as well as multi, so that we can see how good it is and how long it is staying. What highest density can a person get by hair transplant? See, Mr. Brar, there is a mad race going on about the density, and I always explain that if you have, there are three different numbers. One, how many grafts can be placed in the empty area? Again, please listen carefully. How many grafts can we place in an empty area? Second number is how many grafts can we take out from the donor? The number may not match. And thirdly, there is another number: how many grafts should we put in that area? So that means, if we are um, if we have, say, if we can put, say, 3000 grafts in a particular area, and we have enough donor reserves also, shall we put all of them there, or shall we think that we need to keep some of them reserve? So see, any density around, say, 40 45 grafts per centimeter square gives you a good coverage. And then it is obviously different for hairline, different for temples, different for the crown, and different for other parts which are not that important and not directly visible. Okay, so sometimes, and there is another very important difference between the techniques. So if you ask me which method will give you more density, so suppose if somebody is doing 2000 grafts by FUE, and the same kind of donor, same kind of baldness, somebody is doing 2000 FUT. Now, if we compare these 2000 FUE with these 2000 FUT, the density would be higher in FUE. This higher because we have choice to choose multi grafts, and secondly, these grafts have less fat tissue, so they can be placed closely. So that means if you compare the density results of FUT with FUE, you will always find FUE giving you more density. But one has to see at what cost is it coming. So because you are consuming all your donor. So if I am giving you a good density, good coverage with FUT surgery only, and that too, uh, saving your donor, less number of follicles used here, more left over there, and so why not? But yes, if a person is having low grade of baldness, or maybe if we want to work on the hairline, and then later on if you need another transplant, as I've told you, results are not permanent. Hair can thin out, even the transplanted ones, and your existing hair can also thin out. So in that situation, you have to be very careful, very careful. पंकज जी, हम रिसर्च नहीं करते क्योंकि ये रिसर्च के लिए एक डिफरेंट तरीके का सेटअप और डिफरेंट तरीके की लैब और वो सब चाहिए होता है। सो इसके लिए फार्मास्यूटिकल्स करती हैं रिसर्च सारी। Jigs, just watch your 4 months hair progress video and it's looking amazing. Yeah, Jigs, thank you. And now even more, see, my hair have grown even better. And really, I have been doing hair transplants for almost 20 years now. And I have been creating beautiful, natural looking hairlines for my patients. And you know what? I had a broad forehead and I always, used to feel jealous of my patients. And you know uh, one fine day, then I decided, okay, enough is enough, now I am going for it. And that was one of the best decisions of my life. I really, I am like completely changed and I love myself more. Vishal Singh, stem cell. See, what you hear in name of stem cell is majorly a bluff. Stem cells cannot be stored in bottles and all. It is either a mesenchymal stem cell or a stem cell derived from your bone marrow, which can be used on the scalp to improve hair growth. And I was a part of trial around 7 years back. We got mesenchymal stem cells from the stem cell banks, and we used in some of our patients of alopecia universalis, and in some skin patients also for anti-aging purpose we used it, and the results were good. Yeah, so but then since then it has been like not in flow, and we are working on it. शेखर, फ्यूचर में कोई ट्रीटमेंट आएगा? सी, अभी जो करंट ट्रीटमेंट्स अवेलेबल हैं दे आर लाइक काइंड ऑफ गुड, and if we use them thoughtfully, we can we can do something for our patients, even high grades of baldness, with the currently available medicines, PRP and transplantation or synthetic hair implant or scalp micropigmentation. A thoughtful combination of these things can help you. But yes, uh, these things have to be used cautiously with an intent to help. Uh, Ravikant, can natural hair transplant and artificial be done together? Yes, Ravikant, we do combine natural with synthetic because in many cases, which I see, they come to me for repair transplants, and in most of these cases, donor is like kind of gone. So in such cases, we have to combine. Again, I would like to highlight one thing. Most of the cases which I see these days are repair cases by FUE. Like most of the patients have undergone FUE surgery, and the donor is like kind of compromised there. Now, what happens if we are uh, doing, say, an FUE surgery again from a depleted donor of FUE? Then it is a problem because it is going to reduce the density further. So in such cases, it is always advisable to go for FUT post FUE. Sometimes we don't get enough grafts even with FUT because the donor is kind of totally gone. Then we opt for body hair like the chest hair, leg hair, beard hair, pubic hair. These can be used. I usually combine them a lot in my cases. But yes, if that is not available or if that is like kind of used, then synthetic is an option which can be used in combination with natural. So can we choose the type and texture of hair for artificial hairs? Yes, we can choose the texture and types of synthetic hair. It comes in different colors, and it comes in curly as well as straight, and the texture also differs. So we can exactly match the color quality and texture of the patient, and then we can order, and the same we can get with from the company, and then we can plant that. So it will be very difficult for anybody to differentiate between a natural hair existing in that area and a synthetic hair which has been put. So very difficult to differentiate. देन सब मिनॉक्सिडिल फीमेल में सच में वर्क करता है? सी सुहानी फीमेल्स में मिनॉक्सिडिल काम करता है, बट हर फीमेल पेशेंट को मिनॉक्सिडिल देना नहीं चाहिए. बहुत सारे फीमेल पेशेंट्स में मिनॉक्सिडिल की कोई ज़रूरत नहीं होती है, बिकॉज फीमेल्स में हेयर लॉस is usually not that alarming, because females don't have that DHT hormone activity. So in such cases, I try to stay away from minoxidil. In most of my female patients, I don't give it. अगर आपको बहुत ज़्यादा थिनिंग है मिडिल पोर्शन में, फीमेल पैटर्न बाल्डनेस है, तब उसको यूज़ किया जा सकता है, एंड वी शुड नॉट गो बियॉन्ड 2% इन फीमेल्स. और ये चीज़ आपको ध्यान रखनी होगी कि जब आप उसे यूज़ करते हैं और अगर छोड़ेंगे तो फिर आपको प्रॉब्लम होगा. कौन सा मिनॉक्सिडिल ब्रांड लेना चाहिए? कोई भी आप ब्रांड ले सकते हो, बट फीमेल्स में अगेन आई एम टेलिंग 2% मिनॉक्सिडिल के ऊपर ना जाएं प्लीज़. So in diabetes, it has some pros and cons. Okay, so Suvirya Yadav, diabetes, it can be done. Like if you're talking about natural hair transplant, then um, natural hair transplant, there is no problem. If your HB1AC level is like controlled less than 7, 6.5, 7, then we can do the surgery. And in case of synthetic hair implant, one has to be careful, for cleaning and all, because in diabetics, infections can happen. So one has to be very careful. If it is under control, we can do synthetic, we can do natural, anything can be done. रितेश सर, हेयर ट्रांसप्लांट के बाद 15 डेज के बाद वीक में कितनी बार बियर ले सकते हैं? एंड 5.7, देखो आप बियर वगैरह पी सकते हो, ऐसा कोई प्रॉब्लम नहीं है. एंड स्मोकिंग अवॉइड करें तकरीबन 2 से 3 महीने तक, तो दैट विल बी गुड. Kapil Singh, why does hair loss occur? See, there are a lot of reasons why hair loss occurs. It can be because of, most commonly in males, it is genetic androgenetic alopecia, and because of DHT hormone activity. And what else? Sometimes it can be because of alopecia areata or telogen effluvium. So different reasons, nutritional deficiency, stress, they all can contribute. सुधांशु सर, हेयर ट्रांसप्लांट के बाद मिनॉक्सिडिल यूज करना जरूरी है? ओके, सो सुधांशु, आप पूछ रहे हैं हेयर ट्रांसप्लांट के बाद मिनॉक्सिडिल को करना चाहिए, नहीं करना चाहिए? तो देखो, बिल्कुल ये ज़रूरी नहीं है. कुछ पेशेंट्स में देखिए, बेसिकली वी हैव प्रोकैपिल, रिडेंसिल, कैपेक्सिल, मिनॉक्सिडिल, ये सब टॉपिकल प्रिपरेशंस आपके पास रहते हैं, प्लस आपके पास फिनेस्ट्राइड रहता है और बायोटिन और दूसरे सप्लीमेंट्स रहते हैं. तो अगर हम हर ट्रांसप्लांट के पेशेंट को सारी दवाइयाँ दे देते हैं, सपोज़ वी गिव मिनॉक्सिडिल ऑल्सो, फिनेस्ट्राइड ऑल्सो, तो कुछ समय के लिए आपका ग्रोथ बहुत अच्छा दिखेगा. आपका जो मिनिएचराइज़ हेयर होता है, दैट विल डेफिनिटली इम्प्रूव, और वहाँ पर बहुत ज़्यादा थिकनेस दिखेगा. But the problem again is, after some time you can have issues of tolerance. So मेडिसिन को स्टार्ट करने के को कितना करना है और कब करना है, ये सब चीज़ें देखना चाहिए, कीपिंग द इंटरेस्ट ऑफ पेशेंट इन माइंड, नॉट द डॉक्टर. सी, एज अ डॉक्टर, इफ आई स्टार्ट ऑल द मेडिसिन पोस्ट ट्रांसप्लांट, तो मेरा रिजल्ट तो अच्छा दिखेगा, एंड पेशेंट्स विल बी हैप्पी, एंड I can show this on internet, and people will be very happy, and they'll say, oh, Satya gives amazing results and all that stuff. But the thing is, um, how long will it last? We have to see. So sometimes I don't start minoxidil post transplant. Sometimes, in most of the cases, though, I start minoxidil post transplant, usually not going above, never going above 5%. Usually twice or thrice a week application I recommend. And finasteride by default I don't start to my transplant patients, but yes, some exceptions are there when I have to give it immediately post transplant. And even if I give finasteride, then I don't give it daily basis, I give it like twice a week types. Then what is the solution of existing hair loss other than minoxidil and PRP? So see, obviously finasteride is one of the options, and then sometimes this derma pen, derma roller, that also helps. And you can also go for other preparations which I just mentioned, that Redensil, Procapil, some peptide preparations are also there. These things help. These things help. Naresh, your messages are getting delayed. Yeah, I watched one of your videos. There was some guy I Fukran have watched another three videos from your repair cases, patients who done a synthetic hair transplant by Satya. Those patients come. Yeah, Naresh, a lot of cases come for repair, and unfortunately, in many of them, the donor is gone. But I would like to say, yes, in some cases, in most of those cases, even if they think that the donor is gone, we are able to still manage things with combination of FUT, beard, FUE, body FUE. But yes, in some cases, unfortunately, when there is nothing, we have to opt for synthetic. So yes, you have watched the videos. Most of the patients are still in follow up with me, and they are doing pretty well. I try to use as minimum as possible synthetic hair when we are doing as least as possible, because the lesser the number, the longer the life. Yes, every year they have to come for checkup, because we need to clean it and refill whatever areas have become empty now. सुधांशु, आप कर सकते हैं बिल्कुल, आप यू कैन यूज 20 days के बाद आप यूज कर सकते हैं कोकोनट ऑयल, बिल्कुल, यस. सर, does Satya Clinic offer service in Kolkata or only in Delhi? Palash, actually, I would love to come to Kolkata or any other city wherever you are from, Netherlands or every part of world, because I love you so much, everyone. But and the love which I receive from all part of world is, amazing. But the thing is, if I decentralize clinic a lot, and then the quality cannot be maintained that way until and unless I find another Dr. Shail or another doctor who is as passionate as me about this procedure, who can do justice the way I do with my patients. I'm not gonna decentralize till then. So, hair transplant is a good decision, very important decision of your life. And even if you have to travel a bit, I think it should not be a problem. You can contact my team. One day you have to be here, and that's it. We can do everything in one day. So, but yes, for everyone, I would like to say, every clinic, every good clinic cannot be near your place, and every clinic near your place might not be good. Shawar Akhtar, sir, can we use hair color on synthetic hair? Hi Shawar, how are you? And long time since we talked, so we'll talk once we finish this. And yes, synthetic hair, see, don't need actually any color, because they come in different color options, so you can choose. And you can color your existing hair and match them with the synthetic which you have chosen by choice, I mean. So there is no need to color the synthetic hair. शमीमा सर, मिनॉक्सिडिल यूज़ करने से पहले से ज़्यादा हेयर फॉल हो रहा है, अब क्या कर रहे हैं? सी शमीमा, जब आप यूज़ करते हैं मिनॉक्सिडिल को तो शुरुआत में हेयर लॉस बढ़ता है, जो कि 1-2 महीना रह सकता है। ये टीलोजन शेडिंग होती है, इसके बाद दीज़ हेयर कम बैक एंड थिकर बाल आते हैं। बट हाँ, देख लीजिएगा कि आपको हे मिनॉक्सिडिल किसी डॉक्टर के सुपरविज़न में ही यूज़ करिएगा, अपने आप से मत करिएगा आप यूज़ मिनॉक्सिडिल को। सर, ड्यूटास्ट्राइड वीक में कितना सही है? सोहेल सिद्दीकी, सी again I am telling this, please listen to this carefully. uh, See, there is a problem with almost every medicine which you use. As we know, minoxidil. So, see, it is available in two strengths, 2% and 5% worldwide. But in India, we see 7.5, we see 10%, we see 12.5, and now even 15%. Now, why the hell are they increasing the strength? Because of tolerance, because the medicine no more stops working. जब इन्होंने 10% निकाल दिया, अब उसके बाद इनको 15% क्यों निकालना पड़ रहा है? क्योंकि 10% भी काम नहीं कर रहा है अब। सो ऐसे तो आप स्ट्रेंथ बढ़ाते चले जाएंगे। दिस इज द एग्जैक्ट रीजन व्हाई आई डोंट प्रिस्क्राइब फिनेस्ट्राइड टू ऑल माय पेशेंट्स। आप जितने लोग फिनेस्ट्राइड खा रहे हैं पोस्ट ट्रांसप्लांट, उनको, उनमें से बहुत लोगों को ये मालूम होगा कि फिनेस्ट्राइड खाने के कुछ समय के बाद, ये अगर सेक्सुअल प्रॉब्लम्स की बात नहीं कर रहे हैं हम, यहाँ बात कर रहे हैं टॉलरेंस की। हो सकता है साल, हो सकता है 2 साल, हो सकता है 3 साल, 2.5 साल आपको टॉलरेंस बन जाए, तो फिर आपकी बॉडी में फिनेस्ट्राइड काम करना बंद कर देगा। आप जब उसको ले भी रहे हैं, इवन देन इट वोंट वर्क। तो तब आप क्या करेंगे? तब आपको शिफ्ट कर दिया जाएगा ड्यूटास्टेरॉइड पे। और मैं, आई सी अ लॉट ऑफ पेशेंट्स हु एक्चुअली टेक dutastride from the beginning, like immediately post transplant. And it was quite surprising to me because it's a strong medicine and higher container of finasteride, and uh, with more side effect profile. No doubt it is a very strong medicine. In my practice, like I have given this medicine to maybe around 4 or 5 patients till now in 20 years. So please be careful, very careful with dutasteride, and the need arises because when we mismanage the other options like finasteride. सर, वीक में कितनी बार मिनॉक्सिडिल लगाना है ट्रांसप्लांट के बाद? सी, आप मिनॉक्सिडिल तो जनरली मैं तो 2 या 3 बार ही लगवाता हूँ वीक में, इससे ज़्यादा नहीं करता। Dutasteride, Sohail Siddiqui, it shows results in a month's time. It is a very strong medicine and it works like wonder. Is genetic hair loss is reversible for lifetime? Sufia Khan. See, minoxidil, genetic hair loss can stop after some time. So not everybody progresses to grade 6 or grade 7. Sometimes you will find people stuck at grade 4, maybe grade 3. They have those broad foreheads, and then it is a very slow progression and maybe sometimes complete halt. So this can this cannot be exactly predicted, but yes, going by the history, we can see. I mean, we can just family history, we can assess that, we can see the response to treatment also, and then we can give you a little bit of idea about this. हाँ जी, मैं हिंदी में भी बोल रहा हूँ बीच-बीच में, कोई प्रॉब्लम नहीं है। सिंथेटिक हेयर कैन बी डन विद नेचुरल हेयर ट्रांसप्लांट आल्सो। हाँ जी, बिल्कुल सिंथेटिक हेयर को नेचुरल के साथ मिक्स कर सकते हैं। बहुत काफ़ी के पेशेंट्स में हम लोगों को ये करना पड़ता है जब कि नेचुरल हेयर उतना नहीं बचता है। ख़ास तौर से जब आप अपना डोनर ख़त्म कर बैठते हैं थोड़ा ट्रांसप्लांट्स में मिसयूज़ करा के। तो व्हेन यू आर ऑप्टिंग फॉर अ हेयर ट्रांसप्लांट, वन हैज़ टू बी वेरी केयरफुल। अगर आपको ये लगता भी है कि आप सब जानते हैं हेयर ट्रांसप्लांट के बारे में, तो भी मैं आपसे रिक्वेस्ट करूँगा कि एक बार आप हमारे चैनल पे जाके करीब 300 वीडियोज़ आपको मिलेंगे। देखिए एक-एक वीडियो को उठा के, बार-बार देखिए। बहुत सारी इन्फॉर्मेशन आपको मिलेगी जो कि सत्या के चैनल पर आप देखेंगे, और जो शायद आपको कहीं ना मिले। प्लीज़ केयरफुल रहिएगा, ध्यान दीजिएगा। मैं बार बार बोलता हूँ, पहले जानिए फिर मानिए। पहले से ही मान के चलेंगे तो आप प्रॉब्लम में फंसेंगे। HT can be done on scalp suffering with minor scalp folliculitis. Yes, it can be done. We can control minor scalp folliculitis with the help of antibiotics or sometimes topical application itself. Almost all my hair, Mohammed. Yeah. So yeah, you can use minoxidil. Not a problem. आप कर सकते हो, but consult a dermatologist first. First, हाँ. Hi sir, 19 को आया था आपकी क्लिनिक। हाय वसीम, हाँ अच्छा लगा था आपसे मिलके हमें। यस सर, मेरा केस सेम आपके जैसा है। ऐसे हेयरलाइन इज रिसीडेड जस्ट लिटिल, सो आई वांट सेम डेंसिटी एंड रिजल्ट्स एज योर्स, सो एंड माय एज इज 19। सी जशन, यू आर वेरी यंग। देयर इज अ, हमारा केस एक जैसा है पर हमारी स्थिति एक जैसी नहीं है, बिकॉज आई एम 44 years of age, and so at the age of 19 I really won't recommend you to get the hairline too low, or because who knows, in case you might progress to higher grades of baldness, then we cannot consume the entire donor in that area. So one has to be very careful while designing it. So maybe you can share your pictures with my team and let me have a look at your pictures, and then we will see. I need to know the family history also. If you have any elder brother or maybe some cousins, so I need to know all that. So there is a contact form given in description, and you can just ask us on given numbers also, 9999570494. So that's the number. um, or you can mail us at query.satyaskinhair@gmail.com. So hi Poonam, thank you. Gopalasya ji, thank you, well explained. So Siddhi, आंखों पर अगर हम सी सोयल पीआरपी का कोई साइड इफेक्ट नहीं रहता है आंखों पर, और इट इज़ लाइक प्रीटी सेफ। ऐसा कोई प्रॉब्लम नहीं होता है आपको। हर चीज सो Vanraj Mahida. Yeah, micropigmentation can be done in the donor side. In fact, it has to be done in donor side. In fact, in my recent video, I had shared some pictures where the donor was like completely gone, and in most of the cases, donor is completely exhausted. Please be aware. Please be aware. Uh, uh, See, this is a very very wrong trend which is going on, and I see a lot of people talking about hair transplantation after getting a hair transplant done. um, they might be your well wishers, but they are not the right persons who can guide you. I saw somebody who got an FUE done, at some place. It was a botched up transplant, then he got it repaired by another FUE. Now, if you will have a look at donor of that guy, the donor is like very damaged because the angles of hair change when you do FUE because of scarring. So those people who think that FUE does not cause scarring, many of you must be knowing. People who have got FUE done, they must be knowing. So in FUT, if we have a scar, a stitch line, either we can place FUE grafts into that, or we can do a small micropigmentation. But if we have big areas of FUE, we cannot place further FUE grafts in that areas to cover it. So if you shave off, everything is visible from back of your head. So in those cases, scalp micropigmentation is the only option which can help. So yes, donor site scalp micropigmentation is a good option. So sir, if I'm going for 2 session of hair transplant, then how much gap should be? Nadeem Ahmed, see, if you are going for a hair two sessions, see, again I'm telling you, this is again a bluff. Most of the times when people say that, you get one FUE done, we will repeat another FUE after some time, then you are like getting in this, don't fall prey to such traps. See, because if you take out one third grafts, say from a particular donor area by FUE, one third or whatever maximum available you can take out. Now you have already done that. So if you are doing again FUE from the same donor, the angles of exit have changed. Okay, inside angles have changed, so that means there is high chance of transaction. Secondly, if you again take out grafts, then the thing is you are depleting that area. So suppose if you have this much of donor area, can you take out all the grafts by FUE present in this area? No, it is not possible. See, for such cases, the ideal thing, and many a times people say that crown area cannot be covered in one session, so you will be needing another session, which we can do after some time. So I have so many cases which I have shown. You can go through and you can ask my team; they'll share with you where we cover the entire scalp with I mean just one session by combination of FUT, which gives us a major chunk of grafts, FUE from the scalp, from the beard, or from body. So these things can be done. If you are talking about FUT, 2 sessions of FUT, then there should be a gap of minimum 5 6 months between 2 sessions of FUT. So FUT we can do 3 times if the elasticity allows us to do so. If I get PRP sessions regularly, will I be able to keep? Rajat, see, a very difficult question you have asked. Most of the times when you hear that, we are doing every month PRP sessions or maybe 6 sessions an year or so. So I don't think that's right. See, because it induces tolerance. Again, I'm repeating again and again, again and again. See, if you look around, you will find a lot of celebrities getting hair transplants done many times, maybe 3 times, 4 times. You all know Salman Khan. So they have enough money to buy these medicines. They have enough money to get PRP sessions done. But then why do they need repeat sessions of hair transplantation? Maybe synthetic hair implant or maybe a patch. They need this because of the main devil, which is tolerance. So if you don't use your resources thoughtfully, if you are a part of this mad race of showing results, you are going to be in trouble. So it is difficult. See, I know a lot of my patients where we had to give finasteride, and even finasteride is not working in those patients. They have become tolerant to finasteride in less than an year's time, and now uh, kind of nothing works. And unfortunately, in such patients, we see that the hair are thinning and we can't help them much. So nothing can be said with surety in every case. So the rule of thumb is one rule doesn't fit all. So please remember this always. One rule doesn't fit all. So we cannot just blindly, keep doing PRPs or give finasteride to all our patients whom we transplant. Come on, a person who is like 19 years, 20 years, he's eating finasteride. And then I mean, सर मैं 1 साल से लगा रहा हूँ अब मिनॉक्सिडिल एंड फिनालो टैबलेट, अब कैसे बंद करूँ? आप रॉकी प्लीज़ कंसल्ट कीजिएगा मेरी टीम को, थोड़ा आपका हेल्प करेंगे, बताएँगे दिए गए नंबर्स पे। बिकॉज़ इवन इफ यू आर यूजिंग इट, यू आर मूविंग टुवर्ड्स टॉलरेंस। ऐसा कब तक चलेगा? आई डोंट नो। सनी, after your advice on YouTube, I have reduced my Finex dose to once in 2 days and have been using them after my transplant for almost 5 months. Yeah, Sunny. Okay, yeah, I think that's good. Good thing you have done. And yeah, again, I'm telling you, in most of my patients, I don't start finasteride post transplant. And again, many of the cases whom which you see on internet, if they stop taking finasteride, you will actually come to know about the real result of transplant, which transplant has brought to them. So many a times, it is. All the fake numbers which sometimes people do can be justified just because of finasteride. age 28, should I go through hair transplant? So please share your pictures with us, AS. So then only we'll be able to see. Uh, uh, Justin, age, clinic address. It's in Delhi, Pitampura. You can give contact us at given numbers 9999570494. सो आप इस नंबर पे कांटेक्ट कर सकते हैं 9999570494. uh, yeah, at the age of 28 years transplant can be done, but we have to, assess all the pros and cons. uh, I have seen some hair transplant videos on YouTube, and I saw that they have natural hair and nice results, but they are on finasteride. See, Jigs, that's a that's a thing which one has to see, because again I'm telling you, see, if you are comparing results, you have to see this, because today only I was doing a transplant for a patient, and I was doing like 2500 grafts. See, look at me, no finasteride, no minoxidil, and this is my result. The hairline, if you see, and the merging which I have done with the existing hair. So while making the slits in that patient, I was just thinking, how does the mentality of a surgeon like me differs from the other people who uh, put all their patients on finasteride? It is like, when I'm making slits, I'm placing the graphs, when I'm giving you the numbers, the thing which is in my mind is to merge with the existing hair, with the help of these hair, the transplanted hair. But some people might just think, okay, let me place in the front area, and then merging will be taken care of by finasteride. So see, more than, I would say, three times the work is done by finasteride. I'll share a lot of videos and results with you very soon. Please stay tuned. And this is a very important topic, very, very important topic. And secondly, if you are seeing that the results are purely FUE results, then again you are paying a cost for it, because you are using most of your multigrafts in that area, small area. And now if you need hair later on, if you if this guy develops tolerance later on, which is like kind of obvious, or if the guy stops taking this medicine, nobody talks about it, nobody's gonna show this to anyone, and that's it. So it's all about marketing. And I when I do surgeries, and I'm not a stupid, I'm not stupid, I know. If I give these medicines to all my patients post transplant, my results are going to look double or three times the density which you see right now. So but even without those medicines, I'm giving very good results. So what is the need? I keep it as reserve, which I can add later on, so that we can prolong the results for some time. You understand this? आप कर सकते हो, आपके डॉक्टर ने, सूरज, जो आपको दवा वगैरह दिया है, Sunny, I had an FUE transplant almost 5 months ago for 3,000. See, first of all, Sunny, I would like to say that 3,000 grafts by FUE is not possible in most of the Asian patients. Not possible, I'm telling you with my 20 years of experience, if you are sticking to a safe donor zone. Obviously, all the cases, XYZ, you see any case, people who are extracting 3,000 grafts, 4,000, I've seen 5,000, I've seen 7,000. So if people are extracting that many grafts, most of the times it is fake number. Secondly, everything can be justified with after giving finasteride, because your existing hair will grow, and uh, then who cares? Who asks? Then thirdly, if you have really extracted 3,000 grafts from a donor, and now if you are like looking for another transplant, more hair, then please, please, please don't go for FUE again. Change your doctor. Okay, or it is always better, you know for the newer ones also, patients who are actually thinking about hair transplant, they should consult. Go to any doctor, but first consult a surgeon who is competent and confident in doing both the techniques, so that you get to know the real thing for you, you get to know the real possibilities of your donor, and then you can take an informed decision. Okay. So seborrheic dermatitis can be a contributory factor, not exactly the cause always. So females में synthetic hair कर सकते हैं, yes Pooja Singh, it can be done. We do it in females, like, because at times females have a very poor donor at back of head. So in those cases, and most of the marriageable age group females who uh, want these hair back in the front, and they don't have donor. So in those cases, we have to do synthetic hair, and it is a good option, but a temporary option. So yeah, so I think, acha, Debashish, you are asking FUT or FUE. See, I did FUE for myself, and because see, I had a limited area to cover. I did 1300 grafts by FUE, and that is actually I did DSFT. This is direct stimulated follicular transplant. That is my version of FUE, which I do. A lot of people ask me, sir, what is the difference between DHI, DHT, or many people take different names. See, I always tell that the technique is same. The way of implementing is, might differ. So every doctor gives one or the other name to the technique, but it doesn't change the technique. So please, it is FUE, core FUE. So you might not have heard about different names of FUT. FUT comes in only one packaging, while FUE you will see in different packaging. So please try to understand the marketing and that stuff. So, sir, I am 22 years old now, and I had a huge forehead since childhood. Now my hair has started falling crown. Yeah, you should consult a dermatologist for this, and yes, high time. Like, you should start the medicines now. अक्षय, आप हमारे टीम को कांटेक्ट कर सकते हैं. Before, sir, please some best methods to prevent effect DHT on our hair. Pumpkin seeds, flex seeds, chia seeds you can have. They really help. They have good DHT blocking activity. Nuts, almonds, they have good DHT blocking activities. Yeah, play सकते हैं. And mostly, just be happy, stay calm. Don't worry. Even with current methods, uh, we can help you. So your team or clinic WhatsApp number, contact please. So the number is 9999570494. You can contact, this is the number, and this is query dot satya skin hair at the rate gmail.com. So this is the mail ID. Okay, so Sunny, you can book a consultation with me. You can please contact us at the given numbers, 9999570494. So, guys, now it's almost 50 minutes now. So, let us wind up. So, yeah, Pansul, you can have a video consultation with me. You can contact my team for that. Uh, so, yeah. S- so synthetic hair is a good option, but not for everyone. And please be careful with synthetic hair also. I started doing synthetic hair in 2003. So that time, or maybe 2002. So that time, it wasn't that popular. A few years back, I guess around 2.5 years back, 3 years back maybe, I made a video on internet and it went viral. So a lot of people came to know about it, and since then thousands of people approached me, clinics approached me, sir, please have a tie up with me and all that stuff, and you do it with us. And they were like, just mad after money, and they were like, so since then I have noticed a lot of doc- clinics have started doing synthetic hair without telling the patients about the pros and cons, without any experience of dealing with this, without any intent to help, just to make money. They have entered into this. So that is not going to help you. I have done the maximum number of synthetic hair implants in this world, but still the number of people whom I have refused not to do is maybe 1,000 times more. So correct selection of patient is very important, very, very, very important. Okay. So yeah, Spansul, you can contact my team. Yeah, thank you. So let us wind up, and thank you for being with me and listening everything so patiently. And next time when we meet, we'll be discussing about repair hair transplants. So please stay tuned, and thank you. Love yourself, and you can see my video I posted today itself, my journey. So where I'll be discussing something about my transplant. So you can go to the channel and watch that. And you can also follow me on Facebook, Instagram, and Twitter. And especially, I have a separate channel by my name, Dr. Shail Gupta, where I put my music, meditations, motivational videos, and that's an interesting thing that will help, I am sure. Thank you. Love yourself and stay blessed.